Hi there. Today I'd like to show you three options for self-massage, self-MFR for your legs. You can see here I've placed down a yoga mat and some jigsaw mats just to create a space to work, a softer area which can be good. You don't necessarily need these, you can put down a blanket, a rug or work on the carpet. Harder floors might be a bit challenging. And so we're going to use the softer ball today, which I do prefer and use more these days, because that can sink in and we can hang out there for the self-MFR work. But if you don't have one of these at the moment, you can also use a tennis ball, and that's got a bit of squidge in it there, that's kind of a mid-tension. And also you can use a massage ball, one of these spiky balls. But if you're going to use this and there's skin involved here, please do take care, and you can place that in a sock just to protect you from those spikes, because those spikes can pinch the skin if you're working with one of those, so that can work well too. We're going to use this soft squidgy ball. So the first technique, first area we're going to work into is the front of the lower leg here, the outer Tibialis Anterior muscle right there along this line, just at the side of the shin bone you'll feel. So get yourself into position with the ball, and we're looking for any tender areas, so checking through if there's any tender areas there. If there's a particular tender point, it might all feel tender, so I'll find a point and sink down. Rather than move, we can do some massage and move around along this area, along this muscle. But today I'd like to try to find any tender areas and get comfortable, and then sink down, really soften down. And sink your body down through that tender area. And listen to your body, listen to those tender areas. And spend some time there, take a good few minutes. I'm going to shorten the time for the video today for the techniques, but do spend more time here when you try this at home. So give yourself a good few minutes if there's a tender area, see if that softens. And then you can check through again and reposition just to the outer side of the bone and sink down again. The next position we can use today for the legs, we can get to the inner part of the upper leg, the adductor muscles. Sometimes get overlooked, but these can be quite tender sometimes. And in this position, we can be working into both sides of the leg. It's not just the lower leg. But if you can place a support under here, a bolster or a cushion or pillow, to make yourself more comfortable if need be. And again, find any tender areas, let gravity do the work, let this upper leg sink down and soften down, and listen to those tender areas and try and be as relaxed and quiet and in your body as you can. And spend some time there. And the third position, what we can stay here, we're going to work into the outer part of the leg, and you can also get into just the front side of the hip there. So there's a lovely fascial band down here, the iliotibial band, that can sometimes get a little tender. So we can place the softer ball, and the softer ball is really good for here because this is a tender area, can be quite tender, so we don't want to bully that area with firmer tools, particularly firm rollers are too much in there. And so we can find your tender areas. Perhaps if you've worked one side and you've been on one shoulder, you can swap around to give that a break and change position. And sink yourself down similarly and spend and hang out there. Find the tender areas and try and gradually let all the tension go from this lower leg. and see if you can get to soften into that area there. And you can just reposition that for the hip. The front of the hip there, and that can be a bit of instability there, so stabilize yourself. And I'm moving forward, I'm rotating a little just to find that area there, and sinking down much the same to try and soften into that area. Okay, give those a go. Let us know how we get on.